I am Dr. Nanda Rajaneesh. I am a laparoscopic surgeon and a bariatric surgeon in Apollo Spectra Hospital and Sacra World Hospital. After laparoscopic hernia surgery, usually patients can get mobilized within a day, and we recommend patients to be normal and active, but first 5 days they will have some pain. In laparoscopic hernia surgery, what do? We place the mesh and with tackers we fix it. So the tackers go through the muscle, they are quite sharp, they go through the muscle and they cut through the muscle. So you have a lot of discomfort on the abdominal wall. So you should remember that you have discomfort and pain that is expected at least for 3 to 4 days, though it is a laparoscopic surgery. But more you are mobile and moving around, circulation improves on the abdominal wall and muscles and the pain factor is taken away, so that your pain will be less. Be very mobile and be little active. I always tell my patients, if they have kids, go just be around the kids, but don't lift them. At least 2 months you should avoid lifting any weight more than 5 kgs. You should not lift. That is very, very important. You should not lift weights. That's extremely important. And any wound discharge or any fever or anything is there, please report to your doctor. That is also very important. So I don't think there are extremely different care that is needed after laparoscopic hernia surgery. So it's like any other surgery. First 4 or 5 days you will have pain, and later you just have to be mobile. And after 1.5–2 months, I recommend patients can go to gym, and they can also do weightlifting, and they can do yoga, stretches, because in yoga also you will be lifting your own body. You should know that hernia patients cannot lift their own body at least for 1.5–2 months. So yoga, stretches and all you can do only after 2 months. This is what I recommend.